ReAttach is a therapeutic intervention that has been conceived, developed, and pioneered by Dr. Paula Weerkamp of Netherlands over the past 10 years. It is an effective and tailor-made intervention which works wonders not only for people with autism but with neuropsychiatric conditions and emotional, psychological, behavioral, developmental, or physical challenges. Now the first question everyone asks is, how does ReAttach work? There are 6 basic steps of ReAttach: proactive arousal and oxytocin regulation, joint attention for creating connection, multiple sensory processing, social cognitive training for self and relationships, improving connectivity within the default mode network, and cognitive bias modification, optimizing attachment and mentalization. In talk therapies, verbal techniques, and mainstream interventions, you are expected to narrate your thoughts, emotions, and experiences which may cause discomfort and trauma. But in ReAttach, you don't have to do anything except for extending your hands, and the first step of ReAttach starts. Tactile stimulation is provided by the therapist by tapping on your hands, supplemented by auditory and visual stimulation, causing arousal and oxytocin regulation, leading to joint attention and creating optimal learning conditions. This multiple sensory processing works wonders within us. Under controlled stimulus and joint attention, social cognitive training is done, which further helps in improving connectivity. Cognitive bias modification happens during optimal arousal in 3 ways: by adjusting maladaptive conditions, learning new things, and reimagining life by rebuilding new skills and resilience. During optimal arousal in ReAttach, processing and differentiation of problematic schemas and pathological concepts occurs. Once processed, the psychopathology caused by those schemas reduces. During optimal arousal, new positive experiences and skills are added, leading to better self-management. This intervention helps with the theory of mind and mentalization, where understanding for others' feelings, thoughts, reasons, and needs develops. It also allows people to learn about the feeling of attachment. ReAttach utilizes the research evidence base that tapping with the right amount of pressure triggers the release of oxytocin, which fosters trust and safety. Overpressure tapping can induce both cortisol and dopamine release, which has impact on attention and concentration. Some users have also described the experience as if previously clogged processes have been cleared up, resulting in better functioning. ReAttach enhances attachment, which helps in relationship issues, personality disorders, autism spectrum disorder, and conduct disorder. It helps in controlling anxiety and hypervigilance in GAD, obsessive compulsive disorder, paranoia, personality disorders, and hypomania. It regulates depression, bipolar disorder, and borderline personality disorder. Theory of mind and mentalization helps in autism spectrum, attention deficit, conduct disorder, and dementia. Multisensory integration and cognitive skills help in ADD, ASD, OCD, GAD, and personality issues. Trauma intervention and self-soothing helps to treat PTSD, abuse, addiction, and interpersonal issues. Reduced somatization and positive coping style helps in reducing psychopathology in many disorders. ReAttach is used by a broad range of professionals for treatment and rehabilitation. Training for professionals is available in Dutch, English, Spanish, Italian, Russian, Hindi, and Chinese. Contact ReAttach Academy for more information.